In the last episode, we talked about manufacturing and industrialization, how Nigeria prioritized import over homegrown productions. The same rot runs through healthcare. It is one of our deepest national embarrassments. Take the late President Buhari. Whenever he sneezed, he disappeared to London for medical checkup that lasted weeks. A whole president of Africa's so-called largest economy, getting whisked out of Abuja into a private jet, straight to a UK hospital. The current regime has followed the same shameful path. It is disgraceful, but what's worse, Nigerians don't seem to care. Campaign rallies are still packed. People still clap for politicians who openly refuse to use the hospital they govern. It is almost as if our brains need to be removed, scrubbed clean, and reinstalled. How do you vote for a man who promises to fix healthcare when he himself refuses to touch it? Sovereignty demands that if you hold the office of president, you must use the healthcare under your command. If it is not good enough, you build it. Simple. Can you imagine the president of the United States of America flying to the UK for medical treatment? He wouldn't survive the next election cycle. But here in Nigeria, no shame on both sides. Leaders escape to London and the citizens still cheer them on, going to the airports to welcome them. The lowest point for me was the COVID-19 pandemic. Every serious country was scrambling to create a vaccine, investing billions, mobilizing scientists, racing against the death. Nigeria, we sat there, silent, waiting for the West. When vaccines finally arrived, our president and vice president staged a photo op, rolling up their sleeves to take injections they had no hand in creating, asking Nigerians to follow suit.
I have received my first jab, and I wish to commend it to all eligible Nigerians to do same so that we can be protected from the virus.
That image burned into my memory. The highest office in the land reduced to customers, not creators. And the numbers don't lie. The WHO recommends about 4.45 health workers per 1,000 people. Nigeria has barely 1.83.
In 2021, the World Health Organization recorded Nigeria had just 4 doctors for every 10,000 people, an already dire situation. But since then, things have worsened rapidly, and Nigerian Medical Association now says there's only 1 doctor per 10,000 people.
Over 36,000 Nigerian doctors have left for the UK between 2008 and 2024.
For one, I don't have to worry about my salary being paid because I know that at the end of every month, I'm going to get my salary as long as I work. As opposed to Nigeria, I was owed a 6-month salary at a stretch.
We are bleeding talents in an endless brain drain. We don't just lose doctors, we lose hope, training, and investment all the time.
Look, I want you to see my face in every episode, but I'm not going green screen in low resolution. If you like smart city story and have interest in film and urban development and want to help me make better videos, please subscribe, like, and share to folks that will be interested in this movement. If you have got a buck to spare, support me on Patreon or PayPal. Every bit gets me closer to showing up on camera the way this stuff deserve. The current goal is to get to 1,000 subscribers. Help me get there. You click, I film. Honest trade. Click the subscribe button now. Like, seriously. Now let's continue.
We have already spoken in earlier episode about hospitals being central to our civic note system. As president, I will go all in, massively expanding medical and nursing schools, upgrade facilities, and most importantly, pay healthcare workers enough to keep them here. It is cheaper to retain doctors than to train them for Britain. And beyond that, we must embrace telemedicine, especially for rural communities where healthcare access is still a joke. Primary health centers should be the bedrock. Nigeria once pledged to build 1 per ward, but UNICEF notes coverage is far from complete. We would finish it with world-class equipment, trained staff, and reliable drug supply. We would create funds that primary health centers can access to grow into private practices. Maternal and child mortality is a strain on this nation's conscience. Nigeria accounts for nearly 10% of all maternity deaths worldwide. That is 576 women dying per 100,000 births. The first worst rate globally. Over 262,000 newborns die annually. The second highest total in the world. That is not just numbers, that is families broken, futures erased. Free prenatal care nationwide, train and deploy midwives, guarantee 24/7 hospital delivery services. and provide ambulance to pick up women in labor. No Nigerian woman should die giving birth. And let's talk malaria. It is still one of our top killers because we refuse to design our cities right. We keep digging up gutters that breed mosquitoes. The Institute of Design and Heritage I spoke about in episode 7 would mandate underground sewer system nationwide, wipe out mosquito breeding ground, and finally give Nigerians a fighting chance. 57 million Nigerians still live without safe water. Alongside healthcare, I would launch a water treatment plant across strategic zones. The National Health Insurance Scheme is another scam in slow motion.
Nigeria's health insurance scheme, NHIS, which came into force some 17 years ago, still faces a number of challenges. Shortage of funds, misappropriation, inherent lapses in the NHIS Act have accumulated, painting a negative perception by the public about the scheme.
Only about 2% of the population is covered. Compare that to countries where universal coverage is non-negotiable. We would expand NHIS into true universal healthcare funded partly by our revenue and a small health tax. Disease surveillance must also be tightened. Nigeria's CDC should be upgraded into a frontline defense force for outbreaks because prevention is always cheaper than cure. Prevention doesn't stop at diseases. Campaigns on nutrition, breastfeeding, sanitation, and family planning should be national policy. Only 17% of Nigerian babies are exclusively breastfed. This isn't acceptable. Community health workers should be trained to spread knowledge on hygiene, sanitation, and wash-related diseases. And yes, contraceptive must be normalized. Religion should never dictate national policy. If we are to curb maternal death, we need birth control, period. But it is not just about hospitals and vaccines. We need mental health clinics in every state, sports medicine facilities to support our athletes, local pharmaceutical production to cut dependency on imports, and a thriving medical tech sector. Why can't we manufacture our own syringe, MRI machines, and even vaccines? Countries with far less wealth are doing it. We should too. The payoff is enormous. A healthier Nigeria means higher life expectancy, a more productive workforce, and social stability. You can't build industry, agriculture, or even education if your people are sick, weak, or dead. Healthcare is not charity. It is infrastructure. It is the foundation of nationhood. And for me, healthcare reform isn't optional. It is the cornerstone. Because without healthy Nigerians, there's no Nigeria. Watch out for the next episode.
This series isn't about doom and gloom. This is about solution. If I were president, what blueprint could we use to rebuild Nigeria? That is what the next 19 episode explores. From agriculture and energy to urban planning, justice, education, media, and foreign policy, we will be laying out how to rewire the nation piece by piece and make it not just survive but thrive. This is just the beginning, so if you want to see how Nigeria can change, not in theory but in practical and structured way, then you are in the right place. Hit like, subscribe, and turn on notification. So best believe this is going to be a journey worth following.